Is it possible that the subtle whispers your body sends could be a ticking time bomb, silently counting down to a life-altering event you never saw coming? Today, we're going to pull back the curtain on those seemingly innocuous signals, the ones many of us dismiss as mere inconveniences or signs of aging. We're talking about the early signs of heart disease, often misunderstood, frequently overlooked, but critically important. Understanding these can be the difference between a future filled with vibrant health and one overshadowed by medical challenges. This isn't just information, it's a lifeline, empowering you to advocate for your own well-being and potentially rewrite your health story. Imagine this. You're walking up a familiar flight of stairs, a route you've taken countless times without a second thought. But lately, you find yourself a little more breathless, your chest feeling a subtle pressure you can't quite place. You might shrug it off, attributing it to a bad night's sleep or simply being out of shape. Yet, what if that fleeting sensation was your heart, a tireless muscle working every second of every day, trying to send you an urgent message? Heart disease doesn't usually announce itself with a dramatic collapse or a sudden, crushing pain in the chest. More often, it begins with whispers, subtle shifts in how your body feels and functions. These early signs are easily dismissed, camouflaged by the hustle and bustle of daily life, or attributed to less serious causes. But make no mistake, understanding these early warnings can be your most powerful defense. We often think of heart disease as an ailment of old age, or something that only affects those with obvious risk factors. The surprising truth? The foundational changes that lead to serious cardiac events can begin much earlier than you might imagine, silently progressing for years, even decades, before manifesting as a full-blown crisis. This is where the concept of early signs becomes truly revolutionary. It's about recognizing the subtle red flags before they escalate into an emergency. Think of your heart as a magnificent, intricate pump. For it to function optimally, its plumbing, your arteries, needs to be clear and elastic. When these arteries begin to narrow and harden due to plaque buildup, a process known as atherosclerosis, the efficiency of this pump is compromised. This insidious process doesn't happen overnight. It's a gradual accumulation, influenced by genetics, lifestyle, and environment. The early signs we're about to explore are often direct consequences of this underlying arterial narrowing or the heart's struggle to compensate. One of the most commonly misunderstood early indicators is fatigue that doesn't resolve with rest. We all get tired, especially in our fast-paced world. But we're talking about a profound, persistent exhaustion that blankets you even after a good night's sleep. It's a weariness that permeates every cell, making simple tasks feel like monumental efforts. Imagine waking up feeling as if you've already run a marathon. This isn't just being tired, it's your body signaling that something is profoundly off. Why does this happen? When your heart isn't pumping blood efficiently, your organs and tissues aren't receiving enough oxygen and nutrients. This deficiency directly impacts energy production at a cellular level, leaving you feeling constantly drained. It's your body's way of saying, I'm working overtime just to keep up, and I'm running on empty. This type of fatigue is distinct from the exhaustion that comes from a late night or a particularly strenuous workout. It's an unremitting, inexplicable weariness that often accompanies other subtle symptoms, forming a mosaic of clues. Then there's the nuanced signal of shortness of breath, especially with mild exertion. This isn't the gasping for air after sprinting up several flights of stairs. This is the unexpected puffing and panting after a walk to the mailbox, or while carrying groceries, tasks that previously posed no challenge. It's a feeling of not being able to get enough air, a sensation of breathlessness that is disproportionate to the activity. Here's the twist. Many people attribute this to getting older, being out of shape, or even seasonal allergies. But when your heart struggles to pump blood effectively, fluid can back up into the lungs, a condition known as pulmonary congestion. This makes it harder for oxygen to transfer from your lungs into your bloodstream, leading to that feeling of breathlessness. Sometimes, it can even manifest as shortness of breath when lying flat, forcing you to prop yourself up with pillows to find relief. This is a crucial early warning because it points directly to the heart's diminished capacity to handle its workload. Let's talk about discomfort in the chest, arms, neck, jaw, or back. This isn't always the dramatic, movie-style chest pain. In fact, that's where the greatest deception lies. Often, it's a mild pressure, a dull ache, a feeling of fullness, or even a burning sensation that might be mistaken for indigestion. This discomfort can radiate beyond the chest, extending into one or both arms, often the left, but not exclusively, into the neck, jaw, or even the back between the shoulder blades. The insidious part is its variability. It might come and go, making it easy to dismiss. It might feel like a mild muscle strain or simply a crick in the neck. The key here is the pattern. Does it occur with physical exertion and subside with rest? Does it appear when you're under emotional stress? These patterns are critical clues. This discomfort, known as angina, occurs when the heart muscle isn't getting enough oxygen-rich blood. It's a direct signal that the arteries supplying the heart might be narrowed, struggling to meet the demand, especially during periods of increased activity or stress. Pay close attention to any new or worsening discomfort in these areas, particularly if it's triggered by exertion. Now, for a truly surprising one: swelling in your legs, ankles, and feet. You might notice your shoes feeling tighter at the end of the day, or socks leaving deep indentations on your skin. This isn't just harmless fluid retention. When your heart is struggling to pump blood effectively, it can lead to a buildup of fluid in the lower extremities, a condition called edema. The twist here is that it often develops gradually, so you might not notice it until it becomes quite pronounced. You might blame it on standing too long, or salty food. But persistent swelling, especially if it's symmetrical in both legs and doesn't significantly improve with elevation, is a serious red flag. It indicates that your circulatory system is under strain, and your heart might be struggling to manage its fluid balance. Another often overlooked sign is frequent lightheadedness or dizziness. Imagine standing up from a seated position and feeling a brief wave of dizziness, or experiencing a fleeting sensation of being off balance. While occasional lightheadedness can have many causes, persistent or recurrent episodes, especially if accompanied by other symptoms, warrant attention. When your heart isn't pumping enough blood to your brain, it can lead to a temporary reduction in oxygen supply, causing these sensations. This can be particularly alarming if it occurs during physical activity or without any clear trigger. The payoff here is recognizing that your brain's delicate oxygen supply is directly dependent on your heart's efficiency. Any disruption can manifest as these dizzying spells. And here's a common misattribution: nausea, indigestion, heartburn, or stomach pain. Many heart attack symptoms, especially in women, can mimic gastrointestinal distress. You might experience a nagging stomachache, feeling of fullness, or even nausea and vomiting. The twist is that these symptoms are so commonly associated with digestive issues that they are almost universally dismissed. Imagine the surprise when what you thought was a particularly bad case of heartburn turns out to be your heart crying for help. This happens because the vagus nerve, which influences both the heart and the digestive system, can transmit pain signals in a way that's confusingly interpreted by the brain. Don't assume every stomach upset is just what you ate. If these symptoms are unusual for you, or occur alongside other warning signs, it's crucial to consider the heart. Finally, let's talk about snoring and sleep apnea. While snoring might seem harmless, loud, disruptive snoring, especially if it's punctuated by gasps or pauses in breathing, could be a sign of sleep apnea. The shocking truth is that sleep apnea significantly increases your risk of heart disease. During apneic episodes, your oxygen levels drop, putting immense strain on your heart and blood vessels. This repeated stress can lead to high blood pressure, arrhythmias, and other serious cardiac issues. The payoff here is that addressing sleep apnea can be a proactive step in preventing significant heart problems down the line. It's a testament to how interconnected our bodily systems truly are. Now, for the really critical part, a major twist. We've talked about individual symptoms, but the real danger, and often the biggest missed opportunity, lies in the combination and persistence of these signs. One symptom in isolation might be benign. But when several of these subtle whispers start to occur together, or when a symptom persists or worsens over time, that's when the alarm bells should be deafening. It's not just about one red flag, it's about a collection of them forming a pattern. Your body is incredibly intelligent. It has built-in mechanisms to warn you. Ignoring these combined signals is like ignoring multiple smoke detectors going off in your house. The payoff? By being acutely aware of patterns and persistence, you elevate your ability to detect potential problems far earlier than you might otherwise. This isn't about becoming a hypochondriac, it's about becoming an empowered advocate for your own health. So, what should you do if you recognize any of these early signs in yourself or a loved one? The immediate and unequivocal answer is to consult a healthcare professional without delay. This isn't a situation for self-diagnosis or waiting to see if it gets better. Early detection and intervention are paramount in managing and often reversing the progression of heart disease. Share all your symptoms, no matter how minor they seem. Be specific about when they started, how often they occur, what makes them better or worse, and if they are accompanied by other sensations. Your detailed account is invaluable to your doctor. They may recommend various diagnostic tests, such as an electrocardiogram, ECG, blood tests, like cholesterol or high-sensitivity C-reactive protein, an echocardiogram, or even a stress test, to get a clearer picture of your heart's health. Remember, peace of mind through a medical evaluation is always better than the anxiety of uncertainty or the potential regret of delayed action. Don't let the silent whispers of your body become a roaring emergency. Listen closely, act decisively, and reclaim the vibrant health that is your birthright.